Hello, David Fitzgerald here from Dublin Physiotherapy. Today I'd like to talk about core stability exercise for the treatment of low back pain. Most of you will have heard about this idea whereby specific exercises, Pilates is probably the most common, but there are a number of different approaches to try to stimulate the core muscles. The core muscles are generally referred to as the muscles around the midsection, which are the ones which actually protect your lower back. In actual fact, the core muscles involve the abdominal muscles, the spinal muscles, and the musculature below the pelvis around the hips. So all of those muscles work together to try to support the spine. And sometimes exercise approaches which only work the abdomen aren't sufficient to target all of the areas which need improvement in order to try and get the muscle control to do what should be done. One of the things we frequently see clinically is patients who've been through core stability programs, whether it's a Pilates class, a general toning class, but haven't actually got any practical benefits in terms of their pain. Now, there are common reasons for this, and one of the biggest is that people don't get what we would call functional transfer. In other words, they may do an exercise on a mat, on a floor, on a reformer, on a gym ball, but their actual functional problem is in standing or in sitting or in driving or bending perhaps. So in some patients, if muscle tone is generally very poor and don't participate in activity in a general sense, then very often doing a general core stability program will give an improvement in symptoms and will help to improve their functional capacity. But for patients who are more active or who have a better level of muscle tone, we frequently see that they don't get the benefits that they would expect from doing core stability work. In fact, in my opinion, core stability work is over-recommended for people as some sort of magical cure. It's almost recommended, replaced swimming, should I say, as being the miraculous solution for back pain. My opinion really is that core stability exercises need to be specifically targeted to the problem that the individual has. In other words, if the problem is standing, if the problem is bending, if the problem is driving, then core stability exercises, if they are relevant, need to be integrated into the particular task that people are having problems with. Oftentimes, doing exercises that don't directly relate to the positions that you have pain in can sometimes compromise how effective they are, and the worst case scenario just simply be a waste of time. They certainly won't cause any harm, but the question really is it a useful exercise? So I am very much in favour of core exercise, but I think it has to be specific to individual functional deficits. If you would like any further advice on core stability exercise or what specific exercises are relevant to your particular issue, feel free to call Dublin Physiotherapy here on 8829 174. Look forward to speaking to you then. Bye for now.